exercises for early knee rehab. So if you have injured your knee and fracture or bony injury has been ruled out and you know it's a soft tissue injury, I'm going to go through a few exercises just to get the knee range of movement and strength back. So first of all, it is worth doing some knee bends, so mobilising the knee in order to get the bend back. So you can slowly either grab hold of your thigh or your shin as you get better. Feel a pull, but make sure you can't feel any sharp stabbing pain at all, and then you can let go. So you can just glide it to bend it and straighten it as you feel able, or it may feel better to hold it at the end of range there. So that's for bending the knee. Now for straightening, it's good to try and get the straightness back, the extension there. So it is worth maybe pushing down onto the mid-thigh as pain allows, or you could have a bit of a prop under your heel and then push down to allow it to straighten further. So there are two mobilising exercises. I'm going to go through some easier strengthening exercises for the quads. So the quads at the front of the thigh help stabilise the knee. So perhaps if you have had a ligament injury, the quads can help to strengthen the knee despite one or two ligaments being injured. So with this, we're going to straighten, tense, tighten the front of the thigh, lifting the kneecap, hold it, and then you can let go. So as you get better, you can just straighten, hold, and then let go, or you can perhaps hold it for 3 seconds, 5 seconds, 10 seconds, and do about 10 repetitions, and then little and often throughout the day, perhaps 3 times a day, morning, afternoon, and night. Next, working through a bit more range of movement, you can roll up a towel, a cushion, pop it under your knee, and then again, same action in terms of tensing, tightening the knee and straightening there, and then just control through. So straighten, tense, tighten, and then control the let go and lower. So this is working on the inner thigh a bit more, just working through that smaller range of movement, which is important for control when you walk. Harder still is a straight leg lift, so you may want to bend the other leg just so we don't irritate lower back, but you can go for a lift, hold, and then control. With this, if you try and make sure that you're activating the muscles here and try and not cheat by lifting up using the hands. If you're very early stages in rehab, if that helps, by all means do so, but then certainly progress to just lift up, hold, and then let go. So those are some exercises you can do perhaps on the bed or on your couch. And then if I take you through further exercises, perhaps you're more desk-based during the day and working through a bigger range of movement. So again, straightening the knee again, but through that bigger range of movement, hold, and then let go. So straighten, tense, tighten, and then let go. Now, if you did want to work on the knee bend, but perhaps in this position, you could glide the foot back, sliding your heel back, bending the knee, and you can always encourage that stretch, assist it by the other leg to take the bend a bit further. It might help to assist that movement, particularly if you do have a lot of swelling in the knee joint. So whether it feels more comfortable to glide back and then forth as a smooth movement, or just if it's quite stiff, it might help just to hold it for 5 seconds, 10 seconds, and then glide it back a bit further as it gives. That might help there. Again, just to show you extensions or straightening, it might help to use a step or perhaps a stool, and then end range of movement, so you get your knees straight again. So hopefully those exercises help, but the key is to get the range of movement back in the knee, bending and straightening, and then activating these quads whilst you're not weight bearing on it is an easier place to start in your knee rehab. So I hope that helps. Good luck.